Hi, Kevin.
Hello, Sarah.
Thank you so much for taking the time out of your very busy schedule to do this questions and answering interview with us. For those of you that don't know, this is Professor Kevin Gournay. He's the president and one of the founder members of the charity No Panic. So we're very grateful that you've joined us this evening for this. Before we start, Kevin, maybe you would just like to tell us a little bit about yourself and your history with No Panic.
Right. Well, there's quite a lot of overlap there. I'll try and keep it brief. I started my working life as a nurse. I trained to be a nurse and I worked as a charge nurse. And then I got the opportunity to do what was then a novel course in what was called behavior therapy. It's now cognitive behavior therapy. And I eventually went back to school part-time and got a doctorate in psychology. That was a bit of an arduous exercise. I'm now a professor. I'm a professor at the Institute of Psychiatry, Psychology and Neuroscience in London, and I work part-time in Sydney. That's another story. But coming back to my association with No Panic, in 1982, I was completing a research study on agoraphobia, and that was to become a textbook that I edited in the late 1980s. And one of my patients was the domestic services manager at a large hospital near where I was working in the NHS, and his name was Colin Hammond. So Colin had a very successful career. He'd been one of the top 50 table tennis players in the country. And his wife, Marion, used to ride a motorcycle on the Wall of Death. Now, when you met Marion, you wouldn't believe that. Now, the story about Colin is actually on the No Panic website. And if you just put Colin Hammond story into Google, you'll find more detail. But suffice to say, I treated Colin over a couple of years and reduced his agoraphobia and panic, largely by his own efforts. And I stress this because I gave him a lot of advice, but Colin was courageous in facing his fears. In about 1985, Colin then felt that the NHS wasn't the place for him, and he moved to Telford, where he opened a fish and chip shop. Now, sadly, after about 4 years, Colin got a resurgence of anxiety. Now, we'd kept in some contact, but not much. And so I was very surprised to hear from Colin in about 1989. And Colin told me about his anxiety state and the trouble he had getting out and around and the terrible panic attacks he was having. Mm-hmm. So eventually, sadly, Colin had to sell his fish and chip shop. Mm-hmm. Now, one of the things that Colin did to try and help himself was to help others. And Colin set up what was to be No Panic about 30 years ago. And I was honored to be the founding patron. And Colin and I got on famously in respect to the charity. Sometimes I'd get calls from Colin 7 days a week. And never once did I regret those calls because Colin was telling me about how the world was opening to anxiety disorders, and that it didn't matter who you were, it didn't matter whether you were a celebrity, whether you were rich, whether you were poor, you were as likely to get anxiety as anybody else. And in fact, if you look at the history of our patrons, you'll see many of our patrons who look cool, calm, and confident when you see them on screen or you read about them in the newspapers. They'll tell you about their panic and anxiety. So Colin did a great thing in respect of public education, and he gave his life really to No Panic and his family members, Marion as well. Now, Colin sadly died about 15 years ago. Marion died in about 2016, but I think you'd agree, Sarah, their legacy really lives on. And I think if Colin was to see No Panic today, he'd be very proud indeed. So Is that enough background?
Absolutely. That's brilliant. That's absolutely wonderful. Yeah. The main reason that we wanted to do this question and answers is that since the coronavirus pandemic began nearly a year ago now, can you believe it? No Panic has seen a huge influx in requests for help and support, and we receive questions on a daily basis. And I'm hoping that your expert knowledge may answer a few of these and put people's minds at rest a little bit. So, firstly, obviously, the two of the most common questions that we get are, how likely am I to catch COVID? And what percentage of the population has caught and died from COVID?
Right. Okay. Now, I think I can answer these questions about COVID with some authority because after I finished my doctorate, I did some training in epidemiology, and you hear lots and lots of epidemiologists on telly. Now, I wouldn't claim to have the expertise that people like David Spiegelhalter has, or many of the experts. So I know something about the epidemiology, and in fact, actually, just mentioning that when you go back to the history of studying the course of diseases, you can go back a couple of hundred years. And epidemiology is actually a science which I think mid-Victorian times, when outbreaks of cholera were investigated, that was really when epidemiology really, I think, the modern history begins, although there's a history before that. Now, one of the problems we have today is we have too much information. And some of it's good information, some of it's not good information. And I think one of the issues is you need to put certain things into context. Now, as to number of deaths in this country, we're very, very good at counting deaths. We have the Office of National Statistics, which is completely separate from any political party. It's an independent organization. And actually, we're much better at counting deaths than most countries. I think there'd be some argument about that. But that's where I think once you start to look at international comparisons, they begin to break down. In this country, we have about 600,000 deaths a year. 600,000. So that's a lot of deaths. And sadly, tragically, we think we're going to have about 100,000 deaths attributable to COVID in the year ending in March. Now, actually, when you look at that number, it's a huge number, but you have to actually also consider the context of that. Now, as a country, we're now testing more people than virtually every other country in Europe. I think Denmark and Malta test somewhat more, but we test 500,000 people a day. So the point being that, again, don't look at international comparisons too much, because we test people and we identify people having COVID. Some people in some other countries die from COVID, but it's never known. So I think let's stick to what's going on in the UK. So COVID is actually a flu-like illness. It doesn't kill most people, but quite rightly, I think everybody has focused on the people who are most vulnerable. People with underlying health conditions, people over the age of 80, they are the most vulnerable. And I know you're going to ask me about vaccines. So the chances of a fit young person dying of COVID are fairly small. However, having said that, lots of people go into hospital. Lots of people recover. People do die in hospital. There is now an established condition called long COVID, which you'll hear about in the press. And I actually read an article in The Lancet, which is a mainstream and very well-known medical journal this week, that says that of those people who recover from COVID, who've been treated in hospital, they continue to have symptoms many weeks and months on. And those symptoms are fatigue, anxiety, depression. And there again, we've got another source of mental health problems, muscle weakness, heart irregularities, and changes in the lungs. So the condition is a mystery in many ways. As we go on, we're learning much more about it, but it's a flu-like illness which won't kill most of us. If you look at 100,000 deaths a year, that's a lot. But when you've got population estimates of 1 in 20, 1 in 30 people having had COVID very recently, you'll get a picture. I mean, there are probably millions and millions of people in this country who've had or will have COVID before this thing's out
And recovered, of course.
and recovered. And the important thing to say about pandemics is they all go away eventually to some degree. I
Yeah.
mean, flu's a pandemic. We've now got vaccines for flu. Spanish flu killed huge numbers of people after the First World War. That went away. It did come back again. You can go back to the plague and so on. But you don't actually want a lecture on epidemiology here, do you?
Right. Okay. Yeah. So actually following straight on from that, I think it's safe to say that COVID has increased anxiety in many, many ways. Is this normal? And what do you think people can do to reduce their anxiety?
Now, the best question you could ask me, which you haven't, Sarah, is have I got anxious? The anxiety expert. Yes, of course I've got anxious.
Yeah.
Of course. We ran out of orange juice this morning and I had to go into a supermarket. So I got my sanitizer out. I looked around suspiciously to make sure that everybody was wearing a mask. I checked out how busy the shop was, etc. Now, there's that specific anxiety, but I think also more generally, I think I've become a more anxious person. I've
Mhm.
certainly not slept as well. I've woken up in the morning not feeling as bright and bubbly as normal.
Mhm.
And I've certainly been on edge, just generally on edge.
Mm.
Now, that's the norm. And I think that you'd be an exceptional person if you were to say, my mood and anxiety levels are exactly as they were before March last year. So
Mm.
that's the starting point.
Mhm. Mhm.
So the interesting other thing about this is I retired from clinical work about 18 months ago, and I've actually gone back to clinical work as part of the initiative. So I'm back on the temporary register as a practitioner psychologist, and I've come across lots of people, patients, and ex-patients. One interesting thing to me is that some of my old patients who've contacted me are doing rather well, and they're saying, yeah, now the rest of the world knows what I felt like, but I'm actually doing all right. Some patients, unfortunately, have got worse as a result. Their anxiety states have
Mm.
increased. So there's a whole bunch of things which we just don't know about in
Mm.
respect of the impact. One thing that interests me a great deal is that people by and large are resilient.
Mm.
And as we know from lots of studies on post traumatic stress disorder, after major traumas, most people get better of their own accord. They might get symptoms of PTSD. So it'll be very, very interesting for scientists, but I think really important for No Panic to see what happens in the aftermath. And I think the answer to that question is we don't know.
Mm.
So anybody who tells you they can project figures, I think is having you on. I
Mm.
don't think we know it at the moment.
Okay.
We're in the midst of everything.
Yeah, of course. Yeah. Okay, many people, whether they're young or old, are finding the restrictions about staying at home extremely challenging. What would your advice be on managing this, on coping with this new lockdown law once again?
Well, I think you're asking me two questions, and that is how do you cope with your anxiety during COVID and how do you cope with the lockdown?
Yeah.
And I've got, I think, a number of things. Look, I think we've got to live our lives one day at a time.
Hmm.
And I think one of the most important things is we plan our day so that we've got plenty of activity,
Hmm.
because otherwise we'll just end up thinking about this thing all the time.
Yeah. Yeah.
So I think there are some important things that we can do to manage our anxiety. Um, at present, just live your life one day at a time.
Yeah.
I think there are some important things we can do. We know that physical exercise is great for anxiety and depression. It burns off adrenaline, it
Hmm.
improves your mood. So you're allowed to exercise. Please do so. Get yourself out of breath. Obviously, if you've got a health condition, you know you've got to seek medical advice, but most of us can get out of breath without any difficulty
Yeah.
whatsoever, and it won't cause us any harm. So, physical exercise really, really important. Connect with other people.
Yeah.
Just think about the people that you perhaps haven't spoken to, I've been writing letters, and I haven't done that for ages because I'm used to emails.
Yep.
So I've written some letters, and honestly, you write a letter, 100% of the time, I've had wonderful responses back.
Yeah.
So I get my fountain pen out and write a letter. Um, I think the other thing is that I would suggest, I think it's top of my list, is limit the amount of time that you spend on COVID.
Mm,
So personally, I think the news, we have too much of it. I
yeah.
think it's confusing for me. I don't know what is going on a lot of the time because I hear one thing from one media outlet, another thing from another media outlet. So I would confine myself to a very small amount of news watching a day. And if you want information, go to the government websites.
Yeah.
Now, the government websites are independent of the political parties. So if you go to gov.uk, you get all the information you need if that's what you want.
Hmm.
Now, when you reach out to other people and you're making that telephone call to an old friend, I suggest you have a ban on talking about COVID. Talk
Mm,
about other things. Now,
yeah.
all this, I think, keeps your mind off something. Because if you're preoccupied by something over which you've got no control, it's going to make you more anxious and more wound up. And for goodness sake, don't pick that 5 minutes news before you go to bed at night.
Mm,
The
no.
other things are No Panic has got lots and lots of resources. So find some time in addition to your exercise to do a relaxation, to do meditation, to do a breathing exercise. Now, I've learned by many years' experience that physical relaxation exercises don't work for everybody. They prefer meditation, they prefer music or white noise, whatever. Go to the No Panic website, loads of resources, absolutely full of resources. And I think great credit to you, Sarah, and all the volunteers who've kept that website going. And the social media, of course, is also excellent. It's one way that we can reach out.
Reach
So
out. Yeah, yeah, be in touch with people on a
yeah,
daily basis. Absolutely, yeah.
I
um
think you were asking about lockdown, and I think
yeah,
what follows that is probably the question in your mind: what happens when lockdown stops, or
exactly,
we
that's what
start to
I was
ease
going to
off?
say. There's an awful lot of people that are asking us about, they're dreading going back to work. They've been at working at home, or so that's the next step, isn't it? They're actually worried about
Right.
going back into the workplace.
Well, I think that the first bit of advice I'd give anybody, and it's the advice I do give patients, is um, don't anticipate because you just don't know. So it's really important to keep focused on that plan of activities that I've just mentioned now. However, having said that, we have to anticipate and we have to plan. Don't assume it's going to be a catastrophe for you. Just remember how we started this. We all get anxious. People who haven't had anxiety are going to be apprehensive about going back to work. And I think that one of the things about the restrictions is the restrictions are going to be lifted in graduated doses.
Hmm.
We're not going to go from the where we are now to a full life. That's going to take months. Now, in a way, that's a great thing for people with phobic anxiety because the principle of phobic anxiety treatment is face your fears in graduated doses of difficulty.
Hmm.
Now, a lifting of restrictions bit by bit is going to allow you, for example, once the restrictions are lifted to the extent that you can go out and have a cup of tea with a friend in a cafe or in a park outside and do some socializing. That's the first step. And
Yeah.
then the second step, and so on. Going back to work, I think we've been greatly assisted by the recognition that working from home is a good thing.
Hmm.
However, working from home all the time, perhaps not a great thing. So
Hmm.
there's a balance there, and some people are able to work from home. So that's one way of graduating things.
Yeah.
So what I suggest is actually this becomes a feed on your social media because I think that collectively, no panic membership. I've always thought right from the beginning, listen to my patients. In this case, listen to the membership, and the membership support each other, help each other.
Yeah.
That's how No Panic works.
Yeah.
I'm always chastened to remember that one of the reasons No Panic has attracted so many people is many of the members that we had in the early days were people who were failed by professionals like me. So we haven't got all the answers, but it's something about the collective spirit of no panic that really works.
Yeah, of course. Yeah. Okay, so this question is more specialized, but it's been something that's been asked quite a few times over the past few months. Somebody that has agoraphobia, they're not finding lockdown a problem at all, actually, but they're
No,
terrified about the pressure facing them when the restrictions are lifted. We've had a couple specifically that feel they've gone back steps with their agoraphobia.
okay, okay.
What advice
Well,
do you have for them?
I think coming back to the restrictions, I think that many people that I've spoken to have made, I think, too much of a jump. They've been thinking to themselves that they're going to suddenly be expected to go back to normality, normal life, and they're
Mm,
going to be faced with those hurdles. Now, just remember what I said about these restrictions being lifted. Now, I think that the government, and I think governments across the world have recognized that restrictions can only be lifted very gradually. Now, I
mm,
think that suits people with agoraphobia, because agoraphobic avoidance is about the avoidance of many and various situations. So, um, again, graduated doses of difficulty, pick little targets, pick the walk in the park or the trip to the local shop,
mm,
um, and so on. And I think the restrictions are going to help people in that respect.
mhm,
Um, but again, I think as far as no panic is concerned, there's probably a place for a specific recovery program for no panic. You run wonderful recovery programs anyway. So it might be that you dedicate a group or groups to, I'm agoraphobic now, how am I going to deal
mm,
with the restrictions being lifted? But
mm.
they're not all going to be lifted next week.
No,
It's going to be graduation. So one step at a time.
yeah, yeah, that's great advice. Great advice. Okay. Goodness me, the time is passing. We can't finish today though without mentioning the vaccine, Kevin. So over to
Right.
you.
Okay. Well, before the vaccine, I think we've got to make it clear that this isn't going to be the only slot where I'm able to deal with questions. I'm honoured to be the president of No Panic, and I'm going to be here as regularly as often as you want me. So I think this is an invitation to send questions in. They'll come into you, Sarah, not me,
Yep.
but
Yeah, yeah, yeah. That's
um,
fine.
we're going to continue this. But the vaccine is really important. The Queen got the vaccine. Um, Prince Philip got the vaccine. Prince Philip has all kinds of underlying health problems. We're not quite sure what they are, but he's 99 years of age. He had the vaccine. The vaccine was tested by a program, by a number of programs, randomized controlled trials. Now, randomized controlled trials, the scientists who run the trials don't know who's got the real thing, got the vaccine, and who's got the non-vaccine. Now, some of the trials involve giving people saline, so that's just salt water
Yeah.
injections. Some of the trials involve giving people meningitis vaccine, so they were compared. Now, 43,000 people in the big randomized controlled trial that the Oxford vaccine was tested on, and that had people with every kind of health condition you could think of, not children under the age of 18, and not pregnant women.
No.
Although, that what's come out recently is that although it's not for pregnant women, if you're a pregnant woman with exceptional underlying health conditions, your clinician, your doctor may decide that on balance, it's better to have the vaccine or not.
Mhm.
So everybody over the age of 18 with all kinds of health conditions across the population, 43,000 people. Now, one interesting thing about this is of the group who got the placebo, nobody knew at the time whether they were getting the placebo or the vaccine. Of the group who got the placebo, a lot of people got side effects. A lot of people got side effects from
Mm,
saline. Now,
mm,
that happens in every randomized controlled trial where they're testing a drug. So you'll read about people getting side effects from the vaccine. People do get side effects from the flu vaccine. Same with COVID. You might get a temperature for 24 hours, you might get, well, you get a sore arm sometimes. Sometimes you do, sometimes you don't with a flu vaccine, but the vaccine is safe. And, you know, vaccine science, again, goes back to Edward Jenner, you know, the discovery of smallpox vaccine. You know, polio has been eradicated because of vaccines.
Yeah.
One very sad lesson we've got to learn recently is what's happened with measles vaccine. The anti-vaxxers got misinformation out and people stopped getting their kids measles vaccines. And that's led to terrible, terrible consequences. Children dying, getting brain damage, etc. So whoever you are, whatever health condition you've got, go and get the vaccine. You'll be getting your letters. And I'm really so proud at the moment. And this is not from an ultra patriotic point of view, but I'm really proud at the moment about the number of vaccines we're getting in the UK. And today, Sunday the 17th, I think it is, more vaccine centres being announced. So, you know, it's 3.5 million people.
Yeah.
And great take up. So no panic, members. If you're offered the vaccine, take it. Go to the vaccine centre. If you can't get to one of these big centres, incidentally, that doesn't mean to say you won't get the vaccine, because your GP, your high street pharmacy, they'll all be equipped to give vaccines. So hard to reach people, and I know there will be a number of hard to reach people in No Panic, you'll get your vaccine. You won't be excluded if you can't make that 10-mile journey to the vaccine centre.
That's brilliant. Thank you ever so much, Kevin. And as you were saying, yes, we'd love to do another project, another video, because we think that this is the way that we can reach even more people out there. If you do have questions, if you're sitting watching this and you do have questions that you'd like to directly shoot over to Kevin, then you can send them to me. You can email me at sarah@nopanic.uk. No, that's wrong as well. Sorry, I do apologize. sarah@nopanic.org.uk. sarah@nopanic.org.uk. So I was so used to you doing the talking, I lost myself for a minute. Yes, so we'd love to hear from anybody. If you've got any questions, obviously about COVID, etc. We're going to do another one of these very, very soon. Thank you so much, Kevin, for joining me this evening, and for putting a lot of people's minds at rest. And we shall see you again very, very soon. Professor Kevin Gournay.
Thank you. Bye for now.
Thank you. Bye-bye.
Bye.